People who suffer from this disease and follow a diet for gout also need to take medication to control pain and reduce uric acid levels. A diet for gout can help reduce the levels of uric acid in the blood. The diet for gout does not cure the disease. However, it can reduce the risk of recurrent and painful gout attacks, and could reduce the progression of joint damage. People who suffer from this disease and follow a diet for gout also need to take medication to control pain and reduce uric acid levels. In this video we will show you the recommendations and prohibitions to improve this condition. What is gout? Gout is one of the most common metabolic disorders and a painful form of arthritis. It is caused by the increase of uric acid in the blood, which is known as hyperuricemia. It does not usually present previous symptoms, although it can become deposited in the joints, giving rise to really painful inflammations that can be accompanied by fever. Uric acid is produced when the body breaks down chemicals called purines. Purines are produced in the body naturally, but they are also found in certain foods. Uric acid is eliminated through urine. To prevent attacks of gout, or at least make joint damage slow, you can turn to certain foods as a method to reduce high levels of uric acid in the body. Factors to consider in a diet for gout. The specific diet to reduce the levels of uric acid in blood should be focused on controlling three main factors. 1. Urine pH. It is important to try a basifying or alkalizing diet to slightly change the pH of the urine and promote elimination. This is achieved mainly promoting the consumption of basic foods such as vegetables, potatoes, fruit, sweet potatoes, salads. Avoiding the consumption of foods rich in salt and its addition in homemade culinary preparations. Avoid alcohol altogether, including beer and wine. 2. The intake of purines. It is necessary to watch the food that is consumed and also its preparation. When we boil a food that contains purines, a large part of these pass into the cooking water. Therefore it is a good way to reduce the purine content of the food, but the broths should be avoided. 3. The intake of fructose. Fructose, once assimilated by the body, is metabolized into xanthine, a purine that will eventually pass to uric acid. For this reason it is recommended to consume only one piece of fruit per day and choose those that contain less amount of fructose. Allowed foods. Proteins. It mainly consumes red meat and lean meat, low-fat dairy products and lentils as protein sources. Complex carbohydrates. Eat more vegetables and whole grains, which provide complex carbohydrates. Vitamin C. Some studies show that it can help to decrease uric acid levels. Ask your doctor if it would be appropriate to add a 500 mg vitamin C supplement to your medication and diet plan. Coffee. Some research suggests that moderate coffee consumption could be associated with a lower risk of gout. Drinking coffee may not be appropriate if you have other medical conditions. Ask your doctor how much coffee you can consume. Cherries. There are evidence that eating cherries is associated with a lower risk of gout attacks. Foods not allowed. Organ meats and glands. Avoid meats such as liver, kidney and sweetbreads, which have a high content of purines and contribute to increased levels of uric acid in the blood. Red meat. Limit the size of the portions of beef, lamb and pork. Seafood. Some types of seafood and fish, such as anchovies, crustaceans, sardines and tuna, has higher purine content than others. However, the general health benefits of eating fish can outweigh the risks for people with gout. Vegetables with high purine content. According to several studies, vegetables with a high content of purines, such as asparagus and spinach, do not increase the risk of gout or recurrent gout attacks. Alcoholic drinks. The consumption of beer and distilled spirits is associated with an increased risk of gout and recurrent attacks. Moderate consumption of wine does not seem to increase the risk of gout attacks. Avoid the consumption of alcoholic beverages during gout attacks and limit consumption, especially beer. Food and sugary drinks. Limit or avoid sugary foods, such as sweetened cereals, bakery products, and sweets. Limit the consumption of naturally sweet fruit juices. Buy last. Following a diet for gout can help limit the production of uric acid and increase its elimination. Although it is probably not enough to make a diet to lower the concentration of uric acid in the blood in order to treat gout without medication, the diet can help to reduce the number of attacks and moderate its severity.